Bismillah ar-Rahman ar-Rahim. Hello dear student, fourth year medical student. Today we will discuss calcium metabolism. Calcium is one of the most common minerals in the body, and mainly it is derived from dietary sources. It is essential for bone metabolism and other biological functions. What do you mean by calcium metabolism? Is the movement and regulation of calcium ion in and out the body and between body compartments, the plasma, the extracellular and intracellular fluid, and the bone. The function of calcium is important for blood coagulation, muscle contraction, neuromuscular transmission, skeletal growth, and mineralization. And it is the ionized calcium that has this important physiological function. Regarding physiology, more than 99% of total calcium stored in body tissue as a calcium phosphate complex. We call it the hydroxyapatite, while less than 1% distributed between intracellular and extracellular compartment. Of this 1% outside the bone tissue, 40% is bounded to protein, 10% contained in ionic complexes, as in it will combine with phosphate, with citrate, with sulfate, and so on. Remaining 50% is in the form of a free calcium ion that are the biologically active portion of the body calcium. Total body calcium is 1 to 1.3 kilogram. 90% is in the bone and 1% only in the body fluid. This 1% divided to intracellular fluid 0.99% and 0.1%, which is very small amount, in the extracellular fluid, and this is also subdivided to the interstitial fluid and the plasma. The plasma contains 50% of ionized calcium, 8% bound to globulin, 32% bound to albumin, and 10% complex with anions. So how calcium hemostasis takes place? It's required for maintenance of this hemostasis required adequate net intake of calcium as well as vitamin D. The calcium here is important, as we said, for skeletal growth and mineralization. Usually it is the ionized calcium fraction which is physiologically important, and there is a tight regulation mechanism we will discuss later. So maintenance, as we said, require adequate net intake of calcium, and the maintenance of body calcium require adequate milk supplement. The calcium in breast milk is equals to 300 milligram per liter. Formula is equals to 530 milligram per liter. Cow milk contain about 1200 milligram per liter. They are excellent calcium sources. The recommended intake of calcium differ with age. Kids between 1 to 3 years, they require or they need 700 milligram calcium daily. Kids between 4 and 8 years require 1000 milligram of calcium daily, and those between 9 to 18 years, they require 1300 milligram calcium daily. In infant, approximately there is 400 milligram per kg of calcium in their body, whereas in adult they have 950 milligram per kg of calcium in their body. The ionized calcium balance the calcium pool. So it is the ionized calcium, as we said, it is the important part of the calcium in the body which has many physiological function, and it is responsible for the balance of this calcium pool in the intra and extracellular space, and plays important role in bone metabolism. How to maintain this balance is achieved by parathyroid hormone and the active form of vitamin D. We call it 1,25 dihydroxyvitamin D, and also 3 other organs in the body like the kidney, bone, and the intestinal system. If serum calcium level decreases, what will happen? Parathyroid hormone will be stimulated and secreted from the parathyroid gland, and it will act by two ways. Directly, it will act on the bone to promote calcium resorption, and on the kidney also direct way to promote the resorption from the kidney and indirectly on the intestine as it activates 1-alpha hydroxylase, leading to an increased 1,25-dihydroxy vitamin D synthesis. As we said, we require also vitamin D in the diet to maintain the normal calcium homeostasis. Vitamin D here is derived from the cholesterol. There are two major forms of vitamin D, which is exogenous. Vitamin D2 found in the plants and better known as ergocalciferol, or we call it the calciferol. Vitamin D3 found in animal tissue, mainly in the fish, and often referred to as cholecalciferol. These are, both of them are inactive precursor of a potent metabolite. We call it prohormone. They are prohormone and not vitamin, because technically they act as prohormone, as a hormone. There is another source of vitamin D in the skin in form of 7-dehydrocholesterol. When the body is exposed to sunlight, it will be activated, and these precursors first converted in the liver. Hydroxylation occurs in the liver in the presence of 25-hydroxylase enzyme, which converted to 25-hydroxyvitamin D. We call it the calcidiol. Then it will bind again to special vitamin binding protein in the blood and transported to the kidney tubules, where the 1-alpha hydroxylase enzyme in this part in the kidney will convert it to the 1,25 vitamin D, or we call it the calcitriol, which is the active form of vitamin D. So 1-alpha hydroxylase, which is present in the kidney here, this is the 1-alpha hydroxylase enzyme. It will be activated by the presence of the parathyroid hormone and by hypophosphatemia, when there is low phosphate in the blood, and it will be inhibited by the presence of high serum phosphate, hyperphosphatemia, and by the presence of high amount of active form of vitamin D3, as we call it, the calcitriol. Calcitriol acts at 3 non-sites to tightly regulate calcium metabolism. It promotes absorption of calcium and phosphorus from the intestine, number 1, increases calcium reabsorption and excretion of phosphate in the kidney, and 3, it acts on bone to release calcium and phosphate. Here we have to remember that calcitriol may also directly facilitate calcification. It depends on the level of calcium in the blood. When the level is low, calcium level, it will activate to release calcium and phosphate from the bone. But when there is normal level of calcium or even high amount of calcium, calcitriol directly facilitate calcification. And acute regulation of serum calcium depend on the large bone reservoir of calcium. It depends on the bone. As we say, the bone contains 99% of calcium, so it is a very big reservoir of calcium. Parathyroid hormone acts here to increase the number of osteoclasts that dissolve bone and release calcium. And also parathyroid hormone will stimulate the release and activation of 1-alpha hydroxylase enzyme in the kidney. This is the pathway. Here, when there is low calcium, it will be detected by the parathyroid gland and will secrete the parathyroid hormone, which will activate the kidney, and here parathyroid hormone stimulates reabsorption of the calcium from the urine and excretion of phosphate, and it will activate vitamin D, and also act on the bone and stimulate the osteoclast activity, and bone here reabsorbed, which releases the calcium into bloodstream. Indirectly, it has effect on the intestine through activation by the presence of 1-alpha hydroxylase, and it will be activated to the active form 1,25-dihydroxy cholecalciferol. This active form of vitamin D causes an increased absorption of calcium from the diet by indirect way. We have another hormone we call the calcitonin. Calcitonin is produced by the parafollicular cell of the thyroid gland, and secreted in response to hypercalcemia. If the calcium level is high, the calcitonin will be produced from the parafollicular cell, as we said, of the thyroid gland to inhibit release of calcium from the bone mediated by osteoclast and increase urinary excretion of calcium to get rid from the excess amount. Thank you very much.